I'm Leslie Edwards Davis. I'm the Director of Benefits for the Health and Welfare Trust Fund. And we also have two great panelists with us today, Phil Heltzer from UHS and Mary Jo Blomberg from Wellfleet. And I don't know if either one of you would like to take a moment to just introduce yourself a little bit more.
Yes, I'm in patient services. I'm a patient services representative. And we field a lot of questions regarding the health insurance and sort of the connection between students and their health insurance, either enrollments or waivers at this time of year, especially, and just trying to make things smooth for the students if they have questions. So that's my basic job, and also just disseminating information.
I'm sorry.
No worries.
My name is Mary Jo Blomberg. I work for Wellfleet Insurance. We are the claims administrators for the UMass Student Health Benefit Plan. So I'm here to help you today answer any questions that you might have about the insurance and how to use it.
So we'll go ahead and get started. I have just a few slides that I'm going to show, I think. So one of the most common questions that my office gets asked is, what are the differences between the student health insurance and the dental and vision plans? So my goal today is to answer that question for you so that you have clarity moving forward. We've constructed this kind of handy side-by-side chart that tries to outline the biggest differences between the two. So on the left, you have the student health plan. They have a different calendar year than the trust fund. So you'll notice that your student health insurance would have started on August 1st, as long as you were enrolled in at least 5 academic credits, or you submitted your enrollment form. And we'll talk more about all of that in a moment. This is your medical insurance, and particularly for folks who are from other countries who handle this differently, it might be a little bit confusing, but this is the insurance you would use for something like a doctor's visit. You'd also use it for mental health visits. You could use it for the emergency room, for inoculations that you might need. Your dental and vision are separate, and they only have to do with your teeth and your eyes. So in this scenario, they're totally separate from the rest of your body, handled with a different set of insurances. Like I said before, and we'll say it many times through this session, you will have been automatically enrolled for the student health plan as long as you were taking 5 or more credits. We'll talk more about exceptions to that later. The card that will govern this plan is your Cigna card. We got a lot of questions about that. That's not your dental card. That's not your vision card. That's your health insurance card. And if you have questions about that plan, you would go to either Phil in patient services or someone like him, or you would call Wellfleet and talk to someone like Mary Jo, or go to either one of their websites, which have a ton of information. And then sometimes another layer of confusion here is some people call this the GEO health plan. So the health plan is the student health plan provided by UMass, and GEO negotiates the fee reductions for working grad employees who earn those fee reductions. So just kind of some clarity there. On the right-hand side, you have the trust fund benefits. I've already talked about some of these things. One key difference, though, is the third point, which is that there is an application that's required. You're not automatically enrolled. It's not connected to your academic credit status. So you do have to fill out the application, and we'll show you in the next few screens how to do that. Then we'll verify your eligibility for benefits. We will enroll you, send you a confirmation email, and you'll get 2 other ID cards, one for Altus, which is your dental plan, one for IMED, which is your vision plan. So all told, if you're enrolled in all 3 plans, you'll have 3 ID cards. Questions about these plans on the right, you would direct to my office or our website, and we would help you get the answers that you need. And the trust fund itself is a provision that was negotiated into the GEO contract as a way to purchase ancillary benefits like dental and vision and some of the other things that we offer. So that's kind of just a handy, quick breakdown of the differences. And then on this sheet, I like to just kind of compile everyone's key data for each of the plans. So this is what your ID number and group number will look like for Altus, the same for IMED, and the same for Wellfleet. And then some key phone numbers in case you have questions, the websites. So this is a great slide that you can refer back to just as a handy reference guide. Okay, so like I said, you do have to enroll for trust fund benefits. This is what our new enrollment portal looks like. If you haven't been there yet, you're going to want to go to portal.hwtf.org. We've tried to make it even simpler than it has been in past years. Basically, you will use your net ID, which is the initial part of your UMass email address, to send yourself a secure link to the application. The most important question that you answer during this process is who is in your household. If it's just you, which is the majority of folks that will fall into that category, then you'll just select that you don't have a partner, a spouse, or children, and you'll move through the rest of the application. But if you do have some of those folks in your household, you'll want to make sure that you indicate it, because that's how the family benefit parts of the application open up to you. So you'll fill out the application, opt in or out of the different benefits. One question we get a lot is, do you have to make the same choices that you make for your student health plan when you're filling out the application for your dental and vision? And you do not need to make the same choices. These, again, are completely separate. So let's say you have a family and your husband has insurance through a separate employer. You do not need to add your husband to your student health plan, but you may choose to add them to the dental plan if your spouse doesn't have a dental plan separate from you. So you can make independent choices with regard to what you do for the health plan versus the dental and vision. All right. Like I said, we'll send you a confirmation email once we've confirmed that you're eligible for dental and vision. It will have all of your plan information in one email with all of the relevant links. So hang on to that email. It will be useful to you. And then there's a screenshot of the enrollment form for student health here. We're going to double back to this later when Phil is doing his session. So we'll come back to this. It's a little premature right now, actually. But I do want to close out by just going over a couple of things about cost. So the dental and vision plans are free for you as the individual employee who's eligible. We got a lot of questions about that. People can't believe that it's free. It is free. There's no monthly premium that you need to pay. There are things that you might pay as your co-payment for certain procedures. Like if you have a filling done, you will be responsible for 20% of that filling, but there's no monthly premium that you have to pay to be part of these plans unless you select family dental. That's the only plan that requires a premium, and it's $100 for the year, which is by far the least expensive family dental plan you'll find out there. We do subsidize the cost heavily. Family vision is free. When we say family, that means partner, spouse, or child, and/or child. So those are the costs for the trust fund benefits. We will talk about the costs for the student health plan a bit later, and I have a chart that I can show if it becomes relevant. But I think at that point, I'm going to pause and stop sharing and hand it over to Phil, because we've kind of covered what we can cover from our angle of the trust fund benefits. And now let's dig a little deeper into the student health plan.
So a little bit about UHS. UHS is the on-campus healthcare center of UMass Amherst, serving UMass students, faculty, and staff, and their domestic partners, spouses, and children. We are open 7 days a week during the academic semester and Monday through Friday during intersession. We're located at 150 Infirmary Way, Our main number is 413-577-5000. A web address that I use a lot is umass.edu/UHS. And I think that's a really nice gateway to the rest of the UHS site. And our fall semester hours, which we'll be entering in about a week, is Monday through Friday, 8 a.m. to 8 p.m. Weekends and holidays, we're open 11 a.m. to 5 p.m., where we have our walk-in clinic. Some of the ways of connecting with UHS, we do have the walk-in clinic. And one of the ways to access the walk-in clinic is to text UMass UHS to join a queue, and the number for that would be 413-992-3326. Our appointment line is 413-577-5101. And we also do offer a shuttle service, which goes for students living in residence halls. And that number to reach it is 413-577-7425. And of course, in a life-threatening medical emergency, always call 911. We also have, not on-site at UHS, but in another building, the Center for Counseling and Psychological Health. We call it the CCPH, and their number is 413-545-2337, and they're available 24/7 for mental health emergencies. So some of the things that we offer: unparalleled access to same-day and next-day care. We have an on-site pharmacy, lab, radiology, and special services. Acupuncture is one of them. You can reach us 24 hours a day if you have a health question or concern. We have our whole referrals department, so our referrals are very convenient. All our staff are experts in college health. That's our community. And we have AAAHC accreditation. Our motto is UHS cares for UMass. And we really try to live that motto. Here's a slide with a lot of our services. There's general medical care, walk-in clinic, pharmacy, laboratory, radiology. We do have an eye care department, which the GEO, handling that eye care part of it for the GEO students, can feel free to send their students to our eye care. Our eye care is open for anyone who goes to UHS. We have immunizations. That's a busy department this time of year as everyone's getting all their immunizations up to speed. We have women's health, transgender health, sexual health with STI and HIV testing. We have a nutritionist, as I said before, acupuncture. We do offer allergy injection services. So for students who need allergy injections, they can come to UHS to utilize that service. We have a very strong physical therapy department, along with the sports medicine. And sports medicine is not limited to athletes who are in the UMass programs. It's any kind of sports-related injury. And we also do offer pediatrics, and this is very important, especially for people who bring their families to UHS to have the pediatric services. Okay, this is an action item, and I'm very fond of action items because these help us pull together the academic year at the start. So the initial enrollment period for the SHBP would go to September 18th. That is definitely the most seamless time to do it. It's possible to do things like that after the times periods, but it's more complicated. Annual coverage starts August 1st, and the coverage year ends July 31st. Leslie was talking about that, so sort of the time span for each of these plans. A general guideline: student under 5 university credits or in need of a family plan will need to fill out the enrollment form every fall to have continued coverage. So this one can't be done online. This one actually needs the enrollment form to be filled out. And there is a link to the enrollment form on the graduate student health plan page. New students entering UMass in the spring should complete enrollment in January to ensure coverage for the start of spring semester. Enrollment forms can be found on our website, and this is one of the web addresses, umass.edu/UHS/optional-enrollment. And these should be sent to the Patient Services Department for processing. You can bring it in. People do email them, though we do give people sort of the heads up that email is considered a somewhat less secure method of sending forth any sort of personal information. That being said, many people do email them back to us. Especially at this time of year, this double asterisk. Enrollments received last minute take time to process, and this is true, and can take up to 20 business days, which will cause a delay in the coverage. So we've been encouraging the students to make sure that they're enrolled at the university, even if it's just continuous enrollment. This opens the door for enrollment in the student health benefit plan. But if they're not enrolled in the university, that our hands are tied until they become enrolled at the university. And here's a heads up. Don't forget to print your new insurance card to ensure you have current plan information. Also, the current health insurance card is going to be listed for this year. So if you're going to the pharmacy, they're going to see the card, they'll enter it into the system. It just makes it much easier for them to make sure that your insurance is current. This should be done each fall. Spring would be only if you enroll in the spring. And directions for printing your card can be found on our website. And I think there's also a Wellfleet link to that. In my role as a patient services person, I have been sending lots of people their updated health insurance cards because they don't always know how to get there. And we just end up emailing them to them. Okay, what is the health insurance? The student health benefit plan, and Mary Jo's going to answer this much more fully than I can, but this is a very broad outline. It uses a Cigna network, and it's administered by Wellfleet. And some of its benefits are office visits, hospitalization, and ER care. Again, detailed information can be found on wellfleetstudent.com. This is an excellent site. I use it a lot, especially the benefit plan at a glance. And my favorite is the 94-page document that gets into a little more depth of what the plan offers. It's a great place for insurance wonks.
Love it too. I go there a lot.
Yeah. The health insurance will be automatically billed each semester to students taking 5 or more credits. And that also means that you're enrolled. And the waiver enrollment forms are available. They became available in mid-July. Okay, another action item. Students taking 5 or more credits by September 18th are automatically billed for the SHPP. If you do not need the SHPP and have other comparable insurance, you will need to waive. This needs to be done by the deadline, which is also the date for add drop, which is September 18th, to have the fee removed from your bill. The waiver link is located on our website at umass.edu/UHS. It's also on the student health benefit page. There's a nice Wellfleet link on that page. If you're not able to access the link, you can reach out to patient services. You'll probably talk to me because I'm the phone person. And that number is 413-577-5192. And what I will do is take your email address and then I will email the form out to you. And with that, I pass it on to Mary Jo.
Right. So I'm just going to kind of give you an overview of the student health insurance. Okay, so when you go to wellfleetstudent.com and you go onto the UMass landing page, we have a summary flyer of the benefits, and it kind of goes over the same information as what Phil and Leslie had spoken about, is that, Can you guys see the screen? Yes. Okay.
Yes.
All students taking 5 or more credits are required to be covered and are automatically enrolled. So if you don't want the insurance, you have to make sure that you submit your waiver insurance information. If you do nothing, you will remain enrolled. This flyer is posted on our website. It gives instructions on how to waive and or enroll. And these are a quick glance at the benefits. So the plan has a $200 per individual deductible. Per family deductible is $600. Out-of-pocket maximum is $1,300. What an out-of-pocket means is that when you reach that limit, the plan is going to pay 100%. So currently, the plan will pay 95% of expenses for any of the providers that participate in the Cigna network. If the provider is out of network and does not participate, the plan will pay 80%, and you'll be responsible for 20%. So it's a really, really good plan. It covers 100% of preventative care. Physician visits, there is a $10 copay, and then the plan covers 100%. The deductible does not apply, and that would include consultants, specialists, and telemedicine visits. Excuse me, let me just step back. The consultant specialist is a $20 copay. Regular physician visits are $10. And that would also apply to mental health and substance abuse treatment disorders. Impacted wisdom teeth, the plan does cover 95% of the charges. Of course, it covers x-rays, labs, MRIs, CAT scan, it has emergency room. It is a full ACA compliant insurance plan. And your prescription copays here are below. So $10 copay for a 30-day supply of a generic drug. Basically a $10 copay for a brand. So it's a really, really good plan. So we would suggest that maybe you take a look and see if it, suits your needs, but it is really good. So the effective date is 8/1 to 7/31. The fall term goes to 8/1 to 2023 to 1/31/2024. And you are only billed by semester, so the eligibility has to be met each semester. As long as you remain enrolled, the insurance will carry over. Some important terms of the insurance. So deductible means the amount a covered person must pay out of pocket each year before benefits are payable by the plan. The deductible shown above was $200 per individual and $6 per family. Coinsurance is the percentage of the covered medical expense. So in other words, our coinsurance, we're going to pay 95%. Your coinsurance will be the remaining 5%. To touch base again on the out-of-pocket maximum, once that out-of-pocket maximum is reached, the plan will cover 100%. In-network means that the hospital's physician, facilities, practitioners participate in the preferred provider organization, which is the Cigna network. So it's Cigna PPO. Out-of-network means that the providers do not participate in the network. This plan does require pre-certification for any type of hospitalization. So if it's an emergency or a planned hospitalization, the hospital will call Wellfleet and typically pre-cert that care for you. But this is just to make you aware that the plan does require pre-certification for inpatient. Again, wellfleetstudent.com. You can find this flyer. You can find the full plan.
So I just want to show your website too, because I go to your website a lot. I refer a lot of people to your site. It's super helpful. So if you go to wellfleetstudent.com and you put your school in as UMass Amherst graduate, it takes you to this landing page that is very helpful. You can click on this button to waive the insurance in the unlikely event that you have other insurance and you do not want this plan. Sometimes that language waive gets confused because sometimes people refer to fee waivers too. So we like to try to keep it clean and say waiving means getting rid of the insurance. You don't want it. Fee reduction is what happens when the 95% comes off your bill. So try to not waive if accidentally. You want to be intentional if you're waiving. And then you can click on the center button to get the detail about what's covered and the summary. That 95-page document is very helpful, particularly if you're looking for like a very specific question about something very specific and how it's covered. I go and reference that document a lot. This is where you can also, if you log in, you can get your ID card. Is that right?
Yep.
Mary Jo?
Yes, that's correct.
And then you can also search for providers here, and I use this a lot as well. So really helpful website. I suggest once you're enrolled in all of our plans, the health plan, the dental plan, the vision plan, to go to the websites for the plans and kind of check it out, make an account so that when you need something, you'll already be set up to access it.
Can you click on Wave, Leslie?
Sure.
Okay, so once you make your selection, so if you hit Wave on the graduate student site, it's going to bring you to a site where if you are a new user to the Wellfleet site, you will have to create a new account. If you're a returning user, you can log in with your information. And there's a link here too if you forget your password. So I just wanted to point that out because sometimes people don't realize they'll try logging in and it's not working. So new students must always create a new account with Wellfleet.
That's great to point out. All right, I'm going to stop sharing. I'm going to take a look at this question in the Q&A. All right, how do I find my family's ID cards? I see, I log in to see the ID cards, but I only see one for myself. If they are not added, how can I add them? So I think we could both answer this question separately with regard to the different plans. So I'll answer with regard to the dental and vision. So the dental and vision plans, well, actually, let me break that down even further because they handled it differently. So the dental plan, our dental plan only produces one ID card. It's for the subscriber on the plan, and that is the eligible grad employee. And all of their family members will be found by the provider when they look up the subscriber's information in the Altus system. So the family members won't have individual ID cards, but if you go to the Altus system and create an account, you should be able to see all the family members enrolled. The vision plan is slightly different, and this is new with IMED. IMED now is issuing ID cards for each person enrolled on the plan. So the subscriber, and then there's a separate ID card in the name of each dependent that's on the plan. So you will be able to get an individual ID card as a family member, and as the subscriber, you should be able to log into the IMED system and see all of your family members listed there. If you haven't enrolled your family members in our system for the dental and vision, it depends on what place you are at in the process, what my advice would be. So if you haven't enrolled at all and you need to cover your family members, again, you'll go to our portal, and that initial screen where it asks you who's in your household is very important to answer correctly. So if you have children, spouse, partner, you're going to want to indicate that on that screen, and then it will ask you for their names and their dates of birth, and give you an option to add them to the dental plan, add them to the vision plan. If you've already gotten deep into that process and you forgot to answer about your family members, you can back arrow back to that screen and say, oh no, I do have a partner. So that's a little bit about why you might not be seeing your family listed, or where to look to make sure they are listed for dental and vision. And now I'll hand it over to Phil or Mary Jo to talk about how that's handled on the student health side.
Well, I know on the Wellfleet site, when a student logs in, if the dependents are enrolled, they'll see the dependents at the bottom of the page, and they'll be able to print an ID card. If you're not seeing the dependents enrolled, you may want to contact UHS and make sure that you fill out the enrollment form, right? Is that the process? Yeah.
Yeah, they fill out the enrollment form. Sometimes it seems that the individual gets enrolled first, and then the family kind of, collects onto that enrollment. So sometimes it's a matter of waiting for a day or two for, things to reconcile. I usually check Inspire just to make sure that they actually have enrolled in the family plan. But usually what happens when I'm checking if I see one insurance card on one day, if I look again 2 days later, everybody else has joined in. But certainly it's worth bringing to our attention so that we can alert Wellfleet and say, we're not seeing the other family enrollments. Just make sure that, the communication's going well between patient services and you and Wellfleet. Another thing I wanted to address real quickly when you were covering the health benefit plan, services at UHS are fully covered. The only thing that the students are going to need to pay anything for there would be for prescriptions. And then there's that $10 copay for generics or name brand prescriptions. But just given the nature of, with the student health benefit plan, that's one of the perks that it offers, is you don't have to worry about the deductible or, of these thresholds occurring at UHS. And when I first started working there, I checked with my supervisor who also handles Wellfleet, and I said, I'm not seeing any charges for these Wellfleet students. And she said, well, no, you're not going to be seeing charges because they're covered. And I think that's a really nice benefit.
Yeah.
There aren't any more questions in the queue, but I have some questions that we get asked a lot, and I'm just going to pitch them out there, and knowing that people will be wondering some of these things. So we often get asked, can I go to the dentist at UHS? Can I get glasses at UHS?
You can get glasses at UHS. We don't have a dentist.
Right. There
but
is
we have an excellent referral network.
Yes. So you cannot get dental work done on campus, but you can go to an in-network dentist with the Altus plan, very close to campus, many options very close to campus. The vision clinic at UHS is superb. We send folks there with no hesitations whatsoever. They know our insurance inside and out. They're really great to our folks. So that is a great option for using your vision plan with us, the iMed plan, but no on-campus dentist. There used to be way back when I was a grad student, but no longer.
We do offer a cab service.
Really?
With advance notice. Yeah. So if we're sending the students off to, some sort of specialist or someone who, lives a sufficient distance away, that can be arranged. I think we work with, I want to say Celebrity Cab or and occasionally think of, some of the rideshare services, they'll be reimbursed. But we do have a plan for that.
Okay, great. Awesome. Okay, how about this question? I have wisdom teeth that I need removed, and I'm just not sure what applies from the plans that we've discussed today.
Wellfleet covers it 95%.
So Mary Jo and I have old hats at talking about this issue. Go ahead, Mary Jo.
Yeah, so wisdom teeth are a covered benefit. Are they covered under Altus as well? Okay, we would be primary. So if the student had the student health benefit plan and they submit their claim for removal of wisdom teeth, we will pay 95%. The deductible on those services will have to be met if you haven't met your deductible yet. And then the claim is then submitted to Altus, and I do believe they will cover some of the remaining balance.
Yeah. So if you're having wisdom teeth removed, I highly recommend that you book a one-on-one session with me on the website, and I can kind of take you through both plans. I can hook you up with Wellfleet if you have further questions. I can help you navigate this process, because having two insurance plans is a huge benefit, but it also takes a little bit of navigation. So if your wisdom teeth are impacted, like Mary Jo said, your student health plan covers the vast majority of that bill, and then what is left goes to Altus, and they'll cover 80% of the remaining balance. So what you should end up paying for the removal of impacted wisdom teeth should be very, very small. But it really is a thing that we can help guide you with and make the best choices about how to maximize your coverage. So reach out to us or reach out to Wellfleet. We also do a webinar mid-year every year where we really get into the nitty-gritty of how it works. And we have the past slideshows for those that we can send you and a ton of information about it. So definitely reach out about wisdom teeth. How about costs? What will a grad student pay after all of their fees are taken off their bill? And I have the chart so I can share it as part of this answer. I'm answering my own question here. Okay, so if you're GEO eligible, 95% of your health fees are waived. And these are the amounts that you should be paying after the 95% is waived. For 23-24. One point of information is that these full amounts may still be on your bill at this time of year. That is not unusual, and I'm sure Phil will concur that not everything has been removed from people's bursars bills at this point of the pre-semester. So don't panic. If you have not seen those fees come off yet, they should come off. They should be coming off over the next week to 2 weeks. When would you, Phil, when would you be alarmed if you didn't see them removed yet?
That's a good question. I'm not sure if I have a super informed answer for that, but I would say, sometime in the September 7th through the 15th or something, because it seems like sometimes there's like this coordination of what goes to the bursar's office and then what goes to the GEO office and the back and forth. Things are always appealable, and I think it's important for people to know that. So if something goes through the system and it's just not getting resolved, people can file an appeal. And I think this is something that people would say, okay, this hasn't come off. And sometimes it's a conversation between different departments. Again, it'll be between UHS and the bursar's office, and maybe with the GEO people saying, okay, there's this fee, it should be coming off. Why isn't it coming off? One of the things I wanted to point out as well is this dollar amount both goes for the individual semester, though it covers for the whole year. So it'll be 6 months at a time. Because people have asked me, is this what I pay for the whole year? Or is this what I pay per month? No, this covers a 6-month period. And it's both the cost with the 95% off of the student health fee and the student health benefit plan, because both of those are costs that a student's expected to pay.
Yeah, so definitely if it gets into the semester and the fees are still there, it's very rare for that to happen. But definitely you could reach out to the grad employee organization. You could reach out to the bursar's office. You could reach out to the grad assistantship office. These are all offices that kind of know who to contact to find out what's happening. But at this point in the semester, again, not cause for alarm if the fees are still on the bill. They should come off. Let's see. How about this? Am I too late? Like, what if I am not enrolled in 5 credits? I didn't send in the form. Like, where am I at? When will I be covered? How will it happen? We sort of have touched on it, but it might be good to answer it all in one place.
Yeah, my first question I ask people when they call on the phone, and this is happening quite a bit at this point. I ask them, are you enrolled? Because enrollment in the student health benefit plan is based on, are you enrolled as a student at UMass? Otherwise, I'd enroll for the student health benefit plan. It's a great plan, and it's, it offers a lot of great coverage, but that's the primary question. And frequently the student will say, I don't think so. And I'll check Inspire to see what their enrollment status is. And they can have a planned enrollment, but I need to see on the enrollment page that they actually are enrolled for us to move forward with the enrollment in the student health benefit plan. So that's question number one. And if it's, the number of credits comes more into whether it's going to be an automatic enrollment, if the 5 credits are over, or if it's going to need to be a manual enrollment, under 5 credits, or if they're on a family plan, if they're going to add more people to the coverage. The website doesn't cover the family. That needs to come from an actual enrollment form, and there's going to be documentation that needs to come with that as well. For the health insurance, for the individual plan, the health insurance cards. For the family plans, some documentation of domestic partnership, birth certificates for the children, things so that we can plug that into the Cigna Wellfleet system.
All right. I think those were all of the typical questions we get at this time of year. Anything, Mary Jo or Phil, that we didn't touch on that you'd like to make sure we get out there?
Just to remind us, remind the students that they have to go online and print their ID card. We don't mail physical cards. If they want a physical card, we can certainly send one out, but they would have to call customer service. And then they can, request a card to be mailed. Yeah. Oh, that's you?
That's
Phil,
me.
you are so nice.
I try to be friendly. I want to make the thing I was going to emphasize is that UHS really, we try to go the extra mile. We really do care that the students have a good experience at UHS, and we get a lot of positive feedback from people saying, "I wasn't expecting it to be this nice. People were friendly. People were helpful." We really do want to be the kind of health service that you want to go to. I mean, not that you want to get sick or anything like that, but if you need to go to, that you're not feeling shy about going to it. So we really do work to make the students happy.
I like the fact that you can text ahead to, get an appointment set. I think that's a nice feature. It seems like it's a new feature.
I think it was a COVID started feature because we wanted to make sure that if someone wasn't feeling well, that they weren't just sitting in the lobby the whole time,
right? So
that they could go straight from coming in to seeing the health worker that they needed to see. And we've continued that because it's a pretty good practice.
Yes, it is.
Okay, so one extra question here. What is the best way to reach UHS for adding dependents to our plan?
You can email us at Patient Services, and our email address is patientservices, all one word, at uhs.umass.edu. And so it's a lot of times it's very helpful to have that conversation going. You can also call Patient Services, and I can send you out an enrollment form.
And the link to the enrollment form is, I'm going to put it in the chat. We also link to it on our site. So if you're on the Health and Welfare Trust Fund site, there's a tab called your student health plan. And we basically do the same split screen of this is the difference between the student health plan and the trust fund benefits. And there's a link to the enrollment form there as well. And there's one on the UHS site as well. It's all linked to the same enrollment form. All right. So if there aren't any other questions, which I don't see any, I think we can go ahead and wrap up. I want to thank you, Phil and Mary Jo, so much for being here. We really do try to work together to triage issues that cross paths for the various insurance plans. So we really are out there trying to combine our knowledge and our know-how to make sure that everyone gets enrolled in the plans they're trying to enroll in. So definitely reach out to us if you have questions on our various websites that we have. And thank you to the participants. We will be choosing someone to win a gift card for today's session. We'll reach out to you by email afterward. But otherwise, thank you so much, everyone, and have a great afternoon.
Thank you.
Thank you.
Bye.
Bye.